All right. So you guys took the quiz. I think the quiz is all over now. It should have expired. Let me set the day up for you. I do want to talk about chapter 13. Maybe half of the chapters complete that. And then I want to spend the rest of the time. We'd have enough time to actually do a review. All right. So that exam is coming up on Wednesday. I do want to address any questions that you have, but I do want to actually begin this chapter on soil-borne and arthropod-borne diseases, and get to maybe half of it. All right. So let me do that first. That will take about 20 minutes, and then we can transit into the review. I can answer any questions that you have there for me. All right.
Daddy Big likes scootering.
All right. By the way, somebody has their microphone on too loud. Can you just turn that down a little bit? Thanks a lot. Okay, so it's always good to go back and do a review when it comes to infectious diseases. Here's what we've done so far. We've talked about airborne bacterial diseases, upper respiratory tract and lower respiratory tract diseases. That was the subject of chapter 11, right? Chapter 12 had to do with foodborne and waterborne diseases. So we're done with those chapters. In fact, that's what your exam on Wednesday is about. There are two other chapters on bacterial diseases. This one here is chapter 13. It's on soil and waterborne, or soil and arthropod-borne diseases. So again, these are diseases you acquire from getting wounds contaminated from soil. We talked about things like tetanus, for example. And then later on, we won't talk about this today, but next Monday after your exam, there's no lecture on Wednesday, right? We're going to continue with chapter 13, mainly talking about arthropod-borne diseases. Arthropods, things like ticks, lice, fleas, mosquitoes. And then on Wednesday next week, just to set that whole week up for you, we will begin and probably complete chapter 14. So this is on STDs, bacterial STDs, things like gonorrhea, syphilis, and chlamydia, and then contact diseases. And then we're done with chapter 13 and 14. That will be the subject of your next exam, all right? So just to remind you, we're in the 6th week of school. Things are moving on pretty fast. And we're almost halfway done. Let me just start out today with a prayer, and then we can continue. Heavenly Father God, thank you so much again for what you do for us. Thank you for our students. I know they're going through a hard time, maybe studying and with coping with COVID and everything, not being here at campus to study effectively, oh God. But watch over them. I pray for their health and safety, and keep them at bay, oh God. Keep them focused, help them to understand your purpose in their lives, and help them to live it out. Thank you so much for them, oh God, and thank you so much for your presence in our life. I pray this in Jesus' name. Amen. All right, guys, like I said, here's what I'm going to do. I'm going to cover the first half of chapter 13, and this is on soil-borne diseases. Again, here's a table for you. Pretty cool. These tables I emphasized before, they put things in perspective for you. Talks about the diseases. In this case, it's anthrax, tetanus, gas gangrene, and a disease called leptospirosis. I'm going to add another one. It's called melodosis, caused by Burkholduria Pseudomalai. Tells you the causative agents here, of course, signs and symptoms of disease, transmission, and prevention. Again, I don't test you on treatment, so you don't have to memorize antibiotics unless I mention it. All right, I do that very, very seldom. All right, so the first disease is anthrax. If you notice, when we talked about airborne diseases, I said, guys, there's something called inhalation anthrax. I'm not going to address that with airborne diseases. I'm going to address this with soil-borne diseases. When we looked at food and waterborne diseases, I said, hey, guys, there's something called intestinal anthrax. But I'm not going to address it yet. Well, here is soil-borne diseases, and we're going to address it here. Now, anthrax has several different names to it. It's called malignant edema. A disease is called Wool-Sorter's disease. This disease is primarily found in animals. So really, animals are the prime targets for Bacillus Anthracis. That's the organism that causes this disease. Of course, humans can become infected also. Let me just say it's a very deadly disease. If it's untreated, depending on situations, about 80 to 100% of, in the case animals, they die. And think about this. Here's a herd of cattle. Imagine all of them. If you take a look at them, they have the same symptoms, right? Again, think about that huge animal. At some point, spores are formed. So you just have this huge bag, this animal just filled with spores. Think about this. This is a very lethal organism. And again, we learned about anthrax in the laboratory. I mentioned the name to you. We did a spore stain. But think about these huge animals. You have so much spores in them. That's a terrible way to actually disperse the spores in the environment. So when animals die because of anthrax, they have to be actually incinerated. So in other words, burn, and the soil around them have to be treated with quicklime or lye. These are chemicals that can kill spores. So nevertheless, humans and animals are affected by this organism. We can get direct contamination by eating or drinking food from, say, for example, beef or milk that contains spores, or we can pick them up from the animals just by breathing them in, like in Woolsholder's disease. All right? Okay, so here's what I'd like you to know. The organism that causes anthrax, again, this would be secondhand knowledge to you, is Bacillus Anthracis. Remember, this is a gram-positive rod, and it's a spore former, but it's an aerobic organism compared to Clostridium, like Clostridium tetani that causes tetanus, or Clostridium botulinum that causes botulism. So Bacillus Anthracis, it's an aerobic gram-positive rod. It's a spore-forming bacterium. Now, if you look at anthrax, there are three different forms of the disease, and that's why I left them. I didn't talk about them in airborne or waterborne diseases. We're going to address all of these with soil-borne diseases. The first type is the most deadly type. It's called Inhalation Anthrax. So remember I just said earlier, the disease is also called Woolsholder's disease. Here's where that name comes from. Imagine here's a farmer. He has sheep, and there's some spores of the Bacillus anthracis on the fleece, and then you breathe it in. All right, so that farmer breathes it in, comes down with this respiratory disease called inhalation anthrax. Let me just say it again. This is the most lethal form of the disease. 100% fatality if it's not caught on time and if it's not treated with proper antibiotics. All right, I'll show you pictures of these in a second. I'm just going to identify the different types. The second type is the most common and it's the most lethal. It's called cutaneous anthrax. It's about 95% of all infections in humans. I'll show you pictures in a second. But again, it can be lethal also. About 20% of people die in untreated cases. The third form of the disease is in between as far as lethality goes. It's intestinal anthrax. And again, people who get this disease, they've consumed either liquid or food that contains spores of Bacillus anthracis. That spores passes through the stomach, gets into the intestinal tract, spores germinate. We talked about that process in the lab, right? They run out of nutrients, they form spores. When they have nutrients, you go from a spore to a vegetative cell. It's the vegetative cell that causes problems. Produces toxins. I'll mention three of them later on. But these toxins can cause inflammation of the GI tract, bloody diarrhea, and vomiting and things like this. All right? It's 25 to 60% lethal if patients are untreated. So again, to summarize the slide, three different forms of anthrax. We have inhalation, most deadly. We have intestinal, second most deadly. And then we have cutaneous, most common, but least deadly of them all. All right? So again, just to hammer this point, we get infected by ingesting or breathing in spores of this bacterium. Here's a case of inhalation anthrax. We've seen pictures like this before, right? This is an X-ray. Remember, a normal X-ray, everything appears dark. That tells you it's normal lung. Take a look at this individual. This is on the fourth day of disease. Check this out. I mean, everything's white on the X-ray film, right? So that person has literally both lungs are infected, terribly so. There's nothing. This case probably be lethal. It's seen to be a very deadly form of this disease. It's not just part of a lung that's infected, it's the entire lung. In fact, both of them. Here's a case of intestinal anthrax. Of course, this is taken from autopsy. You can see, take a look at this. That's not normal tissue. So there's lots of edema, there's lots of inflammation because the toxins induce this response. In the case of cutaneous anthrax, this is what it looks like. So imagine this is somebody walking through maybe soil area, maybe desert areas or dry areas. The spores are in the soil. And just by chance, maybe that person has wounds on the skin. And imagine some soil gets into the wound, all right? But just in this case, you have spores of Bacillus anthracis. Now, this individual provides nutrients for that spore. A spore germinates, and here's that organism is growing. You produce the vegetative cell that's producing the toxins. So many cases resolve on their own. many cases become quite lethal because the organism in any one of these cases, the organism can slip into the bloodstream to cause a systemic disease. When you have pathogens in the blood, those pathogens go all over. That's a miserable condition, all right? So initially what you see is something that appears to be like an insect bite. And then they become filled with blisters. There might be white blood cells in there. But then it begins to heal over time, and you see these dark spots. This is necrotic tissue that remains. Those are called black eschars, all right? This is when the wound's healing. Here's a very bad case. So initially, the wound was right over here, all right? So again, some soil got into this wound. That spore germinated, produced a toxin. You see lots of edema. Take a look at that. That's pretty bad. You can even see necrosis occurring in this area here, all right? Okay, so a few things I want you to know about the toxins. And again, you don't have to memorize all this in this slide. This is not for you, but I do want you to realize the bacteria produces 3 different toxins. All right, so I'm going to name them for you and tell you their basic functions. So this is what I really want you to know here. All right, let's put a mark on it. One of the toxins is called a PA. That stands for protective antigen. The other is called an edema factor, and the third is called a lethal factor. These toxins, they work synergistically. What do I mean by that? They work together to give you the major effect that we see with anthrax. So let me just say a few things about this again. 3 different toxins: protective antigen, edema factor, and lethal factor. So how do they work? Well, point number 1 with the protective antigen. The protective antigen binds to a receptor on a target cell. All right, so it binds to a receptor. And then that binding encourages the other 2 factors, the edema factor and the lethal factor, to enter the cell. So what's the net effect here? And the net effect is this: edema, that's tissue swelling, right? So this happens here. This factor promotes this. And the other factor, the lethal factor, actually contributes to something called apoptosis. This is programmed cell death. When a cell undergoes apoptosis, it dies. So in this case, that lethal factor promotes cell death. That's why you see necrotic tissues like this. Those toxins are encoded on plasmids. So we talked about plasmids early in the class. A plasmid is a circular piece of DNA. It hangs out in the cell, not required for its replication. So this is not a chromosomal DNA. So if you were to remove the plasmid from the bacteria, guess what? You don't have disease, because those genes that code for these toxins, protective antigen, edema factor, and lethal factor, they are on the plasmid, not the chromosome of this bacteria. And these are the information I want you to know. Again, the 3 different toxins: protective antigen, edema factor, and lethal factor. They're coded for by a plasmid. If you remove the plasmid, no disease, because the bacteria can't produce these factors. These toxins work synergistically, meaning you see the greatest effect in anthrax when these 3 toxins are functioning. All right? Don't worry about this. That is not for you. Don't worry about this. That's not for you. The last thing I want to say about anthrax, it is considered to be a bioterrorist weapon, so it's involved with bioterrorism. There's a vaccine for it. This vaccine is given primarily to military personnel or people who actually will be in areas where this might be a problem. So this is given as 3 different shots over, I think, 18 months or so. Okay, some people have a very bad reaction to it, but nonetheless, there is a very effective vaccine given not to the general public, but to military personnel. This is really toxic. Remember what I said to you: inhalation anthrax is the worst form of the disease. And then cutaneous anthrax is the least dangerous form, but it's the most prevalent. In fact, most cases of cutaneous type. I know most of you are pretty too young. You can't remember 9/11. You weren't there when that probably happened, right? Or maybe you're 1 or 2 years old. Let me just say, during that time, so this is 9/11. This is October of that year. This is about a month after that year. 22 cases were reported. We had some idiots that sent the spores of this bacterium. This is a bioterrorist weapon, through the mail to senators and to one news reporter I know of. I don't know him, but I know of this person. And nonetheless, take a look at this. So we had 22 cases. 11 were of the inhalation type, and 11 was of the cutaneous type. Check this out. Right, there were 5 deaths associated with the inhalation type. This is like almost 50%. And 11 cutaneous were associated with this episode. There were no deaths. That tells you something. that inhalation form is the worst case scenario, all right? It's the most lethal or toxic form. The cutaneous is the least toxic form. And of course, we have intestinal anthrax. That's in between these. None of them, nonetheless, any form can be lethal, all right? I mentioned earlier that when animals die of anthrax, you just can't throw away their body, you know? You have to incinerate them. You got to burn them because here's a huge animal, tons, billions of spores, if not trillions, in this animal. If this degrades, you can have the spores in the environment back here. That's a nice little source, a reservoir. Soil is typically a reservoir for spores to transmit this disease among animals or to humans, right? Also in the area where the animal died, so this is burned, this is after burning, like you see right over here, you have to treat that soil with something that would kill the spores. Typically it's quicklime or lye. These are chemicals that would actually destroy. This is lye, quicklime, chemicals that can destroy the spores. All right, so that takes care of anthrax. Now to move on to the next soil-borne disease, and by the way, if you have questions, go ahead and ask, I'll stop. I'm not hearing anything, so I'm moving on, all right? Now the next disease is tetanus. Remember, we're looking at soil-borne diseases. And let's just go back to the lab, and something we said in lecture also. There are two groups of organisms that form spores that cause disease in humans. One is an aerobe, that's Bacillus. Think about your practicum this week, right? And then one is Clostridium, so this is a genera. We have Clostridium tetani, difficile, botulinum, Organism Perfringens. These are anaerobic gram-positive rods that form spores. Now, what we're looking at here is tetanus. Tetanus is caused by Clostridium tetani. And again, we talked about this in the laboratory. This is an anaerobic gram-positive spore former. Typically, people get tetanus by being punctured. And when soil, in what maybe a nail or a needle or a twig or something, when soil is present on that, and just by chance you have spores of Clostridium tetani in that soil, that organism germinates again, and now you're going to have disease. So some of the symptoms that you see, first of all, now notice this, it says generalized muscle stiffness. So again, there's spasms all over the place, uncontrollably so. So some terminologies for you, I'd like you to know. Trismus. Trismus is clenched teeth. Imagine you can't relax the muscles in the face. You have this clenched teeth, jaw, fixed smile, like you see right over here. I'll talk about this drawing in a second. Optotonus, arch back. The muscles are contracted, and you have no control over them. So you have spasms of back muscle. And then, of course, when that happens, if you mess with respiratory muscles, you paralyze the muscles, then you can't breathe and death can occur, all right? Now, to treat this disease, use an antitoxin because it's the toxin that's causing the problem. And I'll talk about how the toxin works in a second. You can use antibiotics too. Antibiotics kill the bacterial cells. But again, the toxins is what's causing the problem, so you use an antitoxin. Now, just to show you what this disease might look like, this is a painting, of course. This was done in 1809, depicting a soldier who died in the field. This is in battle. A wounded soldier had tetanus. And what you can see right off the bat, even in this picture, is you see muscle contraction, uncontrolled. So this is the spasms that you see because the toxin causes this response. You have lots of spasms all over the place. So he has opisthotonus, arch back, all right? Clenched jaw and teeth. Basically spasms of facial muscles. Again, the patient died, or this person died because of respiratory collapse. Very, very nasty disease. Here's a gram stain. What's the most important stain in microbiology? It's a gram stain. So it's taken from a wound. These are white blood cells. They're called neutrophils. If you've taken A&P with me, you know them pretty well. These are the gram-positive rods. So these are the vegetative cells. It's the vegetative cells that produce the toxins. And there's some staph. You can see some gram-positive cocci right over here. And then you can see, like right over here, it looks like a little tennis racket. Right, this is how this organism is described. Right, those are it's called a terminal spore. Remember, those are endospores. I know you're studying for your practicum this week, so we did all of this stuff in the laboratory. Now, let's tell you about the toxins. But before I actually talk about how this toxin works, I want you to reflect on botulism. So remember, with botulism caused by Clostridium botulinum, remember what we saw there was like this. That's flaccid paralysis. Remember what that toxin did? It prevented the release of acetylcholine. So I know you're studying for your exam on Wednesday. This is a lecture exam. Yeah, you got to know that, right? So that toxin prevents the release of acetylcholine. There's no muscle contraction. When people die, generally because of respiratory paralysis, person can't breathe. Now, of course, with tetanus, we're looking at a totally different thing. Same group of organisms, Clostridium tetani, except this causes tetanus, whereas Clostridium botulinum causes flaccid paralysis. That's botulism. All right. So let's take a look at what this toxin does. We've already been through botulism. Remember what? Let's just look at normal muscle contraction. Just a quick review for you. Here's skeletal muscle. I want my muscle to contract. I want to lift my pair of glasses, right? That requires muscle activity. So the cortex of my brain sends information all the way to the neurons, all the way to the terminal of that neuron, and that neuron releases acetylcholine. We know the story from here, right? Acetylcholine causes skeletal muscle to contract. So we've been through that already. The botulism toxin functions here. It prevents the release of acetylcholine, so no contraction, flaccid paralysis. Now let's look at tetanus. There are two different types of neurons involved here. This is the excitation neuron. This is the one that provides acetylcholine. But now, under normal circumstances, so I just moved this pair of glasses, right? I want to relax my muscle. I have to stop the release of acetylcholine. There's another neuron, it's called an inhibitory interneuron. Check it out, right over here. This one produces neurotransmitters. Two of them really important, glycine and GABA, all right? So these are the neurotransmitters. What these transmitters do, it tells this one, stop releasing acetylcholine so you can relax. So let me say that again. The normal release of acetylcholine causes muscle contraction. The botulism toxin prevents the release of acetylcholine, so you have flaccid paralysis. In the case of tetanus, here's what happens. That toxin works at this level. It prevents, notice this, remember it prevents the release of glycine and primarily GABA and other neurotransmitters too. But what it does, it prevents, literally blocks this process here. This other neuron keeps on releasing acetylcholine. What's going to happen if you keep on releasing acetylcholine? Then you're going to have spasms. And that's what we see here, all right? So this is what I'd like you to know. Right over here, the toxin is an exotoxin, not an endotoxin. It's produced by the organism and released. That's an exotoxin. The tetanus toxin prevents the release of glycine and GABA primarily. There's another toxin it's called tetanolysin. This one is a cytotoxin. We don't understand exactly what this does, but the major one is right over here, tetanospasmin. All right? Here's a baby who has tetanus. If you notice, take a look at this. This is not flaccid. Remember that baby from botulism? Just limp, right? This one has contractions, spasms. You can tell right here. This is tetanus. Here's a person just before he died who had tetanus. Take a look at that. Notice this, the arched back, the fixed smile, the opisthatonis trismus, and then, of course, respiratory muscle paralysis. Very terrible conditions here. All right. And again, you don't have to worry about this rating system. It's not for you, just to understand the mechanism of the toxin. I do want to show you a video of babies who have tetanus. And in this country, we don't have much of a problem with this. Remember that vaccine, DPT, diphtheria, pertussis, and tetanus, right? So that vaccine covers tetanus. Many parts of the world, people are not vaccinated. And kids in particular, basically they can end up with this problem here, all right? So let's take a look at this video, and hopefully you can get a sense what happens in real life with these people who have, babies in particular. Let me just say who have tetanus. Let me just get, it's pretty thick language. You might not be able to understand, so pay attention carefully. This case is in India. It's a very thick accent, but I think just the video alone gives you a sense of what goes on with this disease. All right, let me know if you're seeing the video. It's coming up. All right, sometimes we have problems with this. All right. So pay attention, all right?
This clinical video demonstrates the case of Tetanus neonatal and its management. Now let's see what are presenting complaints in these patients. 6-day-old male child weighing 2.6 kg was brought by parents with complaint of refusal to feed since 1 day. Mother was not immunized with tetanus toxin during pregnancy. On examination, we noted muscle rigidity and spasm of skeletal muscles. Note that spasm and rigidity are precipitated by touch and noise. Trismus or lockjaw caused by spasm of masseter muscle is another common presenting complaint. Sustained spasm of facial muscles produces a characteristic facial appearance known as lysis sardonicus. Spasm, which lasted few seconds in early stage of disease, become prolonged as disease progresses. This is another 8-day-old female baby of Tetanus neonatal. Note that spasm of laryngeal and respiratory muscles lead to obstruction of upper respiratory tract. As a result, choking episodes and sinuses ensue. Tonic contraction of lumbar muscles lead to ophistotonic posture. Diagnosis of this disease is made clinically and microbiological diagnosis is rarely needed. Let's review few important points before going on to management. It is also known as 8th-day disease as many babies with tetanus die on 8th day of life. It is caused by Clostridium tetani, a gram-positive strict animal. Spores of Clostridium tetani present in animal feces and soil on coming in contact with umbilical cord stump under anaerobic conditions terminate to produce two toxins, tetanospasmin and tetanolysin. Tetanospasmin is responsible for pathogenesis and has high affinity for nervous system. Tetanospasmin bind gangliosides of gray matter of nervous system and block synaptic inhibition, thereby directly enhancing excitatory synaptic action. Tetanospasmin resembles strychnine in its effect. Tetanospasmin acts presynaptically, whereas strychnine acts postsynaptically. At present, there are no standard recommendations available on management of tetanus neonatal. So management should be approached logically to have better outcomes as mortality is more than 90%. Skillful nursing is most important part of care of these babies to prevent aspiration pneumonia. Nursing staff skilled in handling these babies know that these babies need minimum handling as each dust and noise stimuli precipitate spasm and seizures. Oropharyngeal secretions need frequent suction. Temperature should be watched and controlled. Babies are not maintaining oxygen saturations. Warm, humidified oxygen should be given. Oral feeding should be stopped and IV line should be secured for nutrition and drug administration. To reduce further production of toxin, umbilical cord stump should be cleaned properly on admission of baby in intensive care unit. Crystalline penicillin is given IV in the dose of 1 lakh units per kg per day for 5 days to eliminate Clostridium tetani. Antitoxin therapy in the form of human anti-tetanus immune globulin is given IM or intrathecal. In my experience, as well as many studies published in past supports intrathecal immunotherapy to be more effective. Human tetanus immunoglobulin dose of 150 international units per kg in a single dose is sufficient. 250 international units administered intrathecally confer additional therapeutic benefit. Sedation is maintained with intravenous diazepam in a dose of 2 to 5 mg. Maximum permitted dose is 2 mg per kg per dose. And intravenous chlorpromazine, a dose of 2 mg per kg per dose, every 2 to 4 hourly, alternating with each other so that a sedative dose is being given every 1 to 2 hours. Phenobarbital should be avoided as it precipitates apneic attacks. Dose and frequency of administration of sedatives should be titrated based on clinical observation to achieve maximum sedation and relaxation with minimum side effects. Muscle relaxants are of limited use. Tracheostomy and assisted ventilation is an option in babies with frequent episodes of choking, apnea, and respiratory failure. Babies who survive do not manifest any neurological sequelae except when acute episodes are prolonged and unattended. Tetanus neonatorum survivor should be immunized with tetanus toxoid vaccine.
All right, guys, so you can see that can be a very dangerous disease, especially in babies. Yeah, go for it. Yeah. All right, so management. So skillful nursing is really appropriate here, like for everything else, right? But keep in mind, you have to, that toxin is a very powerful toxin. Again, we understand what that toxin does, right? It prevents the release of GABA and glycine. So basically, that person is always producing acetylcholine. You can always activate the muscle. So it's important to give the antitoxin. Antitoxin is basically is antibodies directed against the toxin itself. You can get that from a human source or from an animal source. You have to watch out for breathing because when people die, typically it's because of respiratory paralysis. So again, you think about you have to maintain proper ventilation. If you see problems occurring pretty rapidly, then that can lead to the demise of that patient pretty rapidly. All right? Okay, good. All right, so we're moving on. Again, keep in mind we're looking at soil-borne diseases. The next on the list is another Clostridium species. So here's what we talked about 3 things so far. Clostridium botulinum causes botulism, and actually 4 things so far. Clostridium tetani causes tetanus. We talked about C. diff. Clostridium difficile causes pseudomembranous colitis. And here's the other one on the list is Clostridium Perfringens. So again, this is an anaerobic gram-positive rod. Typically, people get infected by coming in contact with soil that contains the spore of this organism. Now, the biggest problem here is gangrene, and specifically gas gangrene. So first of all, let me define what gangrene is. Gangrene is a disease due to the stoppage of blood flow. Think about what that means. Imagine I have poor blood flow to my arms and then to my fingers, right? At some point, my finger area, my extremities, I'm going to have less oxygen, less nutrient in that tissue. So again, it becomes anaerobic. At some point, it's never totally free of oxygen. There's always oxygen, some oxygen in there. But again, this is an anaerobic organism. The less oxygen you have, the better it is. All right. So imagine a diabetic patient. This typically happens in diabetic patients people with severe diabetes. They might have wounds on the extremities, the fingers, for example, or the feet. And imagine if some spores get into these areas. Typically, what you're going to see is gangrene or gas gangrene. And many bacteria can cause gangrene, but anaerobes cause some major problems. Why? It's because there's a lack of oxygen in those tissues. If Clostridium Perfringens get into those wounds, it starts growing, produces a whole bunch of different toxins, a very virulent organism. And again, that leads to necrosis, to sepsis. In many cases, you have to do amputations. In many cases, people die because there's so much toxins that travel around so fast in the body. All right? So the organism that we're looking at, the primary one, that causes the worst type of gangrene, and again, many different organisms can cause gangrene, is the anaerobe that we call Clostridium Perfringens. People have intense pain, swelling, edema in those sites. The tissues start to die, so you have tissue putrefaction. And sometimes if you put your ear close to the wound or to where there's lesions at, you can hear a crackling sound. That's because gas is bubbling in those areas, all right, in the wound. Now, the organism produces many different toxins. I just want to mention a few here. Lecithinase. This is an enzyme that destroys cell membranes. Hyaluronidase, we saw that before. This is also called a spreading factor. It destroys connective tissues so the organism can move around more freely. Produces hemolysins. These are toxins that destroy red blood cells. And then, of course, neurotoxins that mess with neurons. Again, transmission typically is from soil. Spores are picked up in soil, get into wounds, and now we have a condition like this. So these are gangrenous fingers. Take a look at that. That's dead tissue. That's necrosis. Poor circulation, poor blood circulation, so you have decrease of oxygen, right? these tissues become anaerobic pretty fast. It's a very good site for this organism to grow because it's an anaerobe. It's a gram-positive rod, as we mentioned to you before, and it's a spore former. I have some pictures for you of people with gangrene caused by this organism. You can see tissue death right here. You can see those little sacs. Typically, you have bubbling gases that are produced. As you see right over here, gas gangrene. As the organism grows, destroys tissues. It's also producing gases that bubble and so on and so forth. All right. This is a result of amputations. It's got pretty toxic, pretty fast. Right here, this was cut off earlier, but that disease spread, and you can see lots of necrotic tissues here. One way to help take care of this problem is through debridement. This is cutting away dead tissue caused by this organism, and hopefully you can save that limb, or in this case, it's the foot. All right. In some cases, hyperbaric therapy can be used. So in this case, with the hyperbaric oxygen therapy, you put a person in a chamber, and then you saturate that chamber with oxygen. Well, that's pretty cool, right? Because oxygen can penetrate tissues, and the thought is this. Because this is an anaerobic organism, maybe oxygen can reduce its growth on proliferation. But this type of therapy is not used primarily for this. It's used to actually remove carbon monoxide, and people try to commit suicide. Basically, carbon monoxide sticks pretty tightly to hemoglobin. You can use this type of therapy to remove carbon monoxide from their hemoglobin. But nonetheless, we can also use it for anaerobic diseases also, because anaerobes very susceptible to oxygen. Oxygen can kill those organisms. All right. Now we have two other organisms to talk about, and I'll stop and I'll do a review with you for the exam if you have any questions. Fourth on the list, soil-borne diseases is leptospirosis. Now, what causes this disease is Leptospira interrogans. Take a look at it. As you see, it's a spirochete. Does that ring a bell? So we talked about Treponema pallidum. That's the one that causes syphilis. It kind of looks like this, right? Another disease we're going to see later on in the next half of this lecture on Monday, it's the one that causes Lyme disease. That's Borrelia burgdorferi. These are spirochetes. All right, this is a zoonotic disease. It's transmitted to humans from animals, specifically rodents, rats, and mice. So here's what happens. Let me summarize what happens here. An animal might be infected with Leptospira interrogans. That animal, that organism can get into the urinary system. So basically, that animal urinates in the soil. So imagine I have moist soil here. It contains the organism. It contains Leptospira interrogans. And then here somebody comes by and they're walking along. Maybe they have a wound in their leg or in their arm or something. And then that soil gets into the wound. Now, the bacterium Leptospira interrogans, is present in the wound. Most of the time, people probably recover. They don't even know they have the disease. And again, by the way, this happens mainly in the Hawaiian Islands. We don't see too many cases in the continental United States. So most of the cases are in Hawaii. Nonetheless, that bacterium can just infect wounds. Generally, probably most of the time, people recover pretty well without any problems. But in some cases, that bacterium can go straight to the bloodstream. And then we have a very different disease, all right? So now we have Leptospira interrogans in the bloodstream. That becomes systemic, right? Because blood travels all over the place. That bacterium can be transported to the liver, to the lung, to the brain, to the heart, practically anywhere in the body through systemic spread. This infection, this systemic disease, is called Weil's disease, all right? So Weil's disease, mortality rate can be pretty high, 10 to 15% or so. Think about it. If it's pretty high, 15 out of 100 people die because of a disease like this. So it involves the kidneys, the meninges, the liver, and so on. So this is a systemic disease. Last on the list today is a disease called melodosis. The organism that causes this disease is a soil organism. It's called Burkholduria Pseudomalai. All right. This used to be classified as Pseudomonas in the past, but it's a different species from Pseudomonas. This is called Burkholduria Pseudomalai. Typically, this organism is present in the soil again. It can actually enter wounds. You have contaminated wounds, soil that contains the organism, or it can be little dust particles where the bacteria can actually get into the lungs. One of the reasons why we learned about the existence of this organism is through the Vietnam War. All right, so the Vietnam War. So we had a lot of veterans come back from Vietnam, and then later on in life, many of them came down with this very nasty, serious disease that's called melodosis. Well, apparently the organism can exist for a long time in a dormant form. So this isn't the lung. Think about TB, that's the closest parallel I can make here. People have that organism in the lung, not much is happening, and then all of a sudden the organism kicks up. In the case of TB, to cause tuberculosis. In this case, what happens is individuals get older, your immune system depresses, that organism now kicks up, and then to cause a very nasty disease. Let me just say, if it goes undetected and untreated, it's 100% fatal, all right? So this is called a medical time bomb disease for obvious reasons. As you get older, if you just happen to have this organism in the lung, there's a possibility for the organism to explode in numbers to cause disease. So initially you see a pneumonia. This is an acute disease, all right? And then we see septicemia, the organism moves from the lung, produces these toxins. You can find the organisms, and their toxins in the bloodstream, and in this case can be quite serious. Of course, now you have a systemic disease. Here's a picture of a spleen. All these areas back here, it's infected with this organism. Burkholduria Pseudomalai. All right, and that's it. So when we get back on Monday after your exam, I'm going to cover the other half of this chapter. It has to do with arthropodborne diseases. So these are diseases that are transmitted to humans. They're zoonotic diseases transmitted to humans via lice, ticks, lice, and fleas. All right. Okay.